Welcome to Science, Health and Healing, Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is the Oxygen Model of Autism, Part 8, Vitamin B12 and Glutathione Support. The oxygen model holds that at the foundation of all elements, cause, clinical course, control of symptoms of autism and related developmental disorders is dysfunctional oxygen metabolism, which may be caused by any number of insults, whether they're toxic metals or mold toxins, or the conditions in a toxic womb state before the baby is born. In this video, I want to relate to you my personal experience. Sometimes the results are really nothing less than dramatic. And I find large doses of vitamin B12, it has to be given by injection. Yes, you should certainly try vitamin B12 lozenges, but there are problems of absorption. I also find that when you combine vitamin B12 with B complex, especially B6 and magnesium, and my favorite for this are glutathione and taurine. Glutathione can be 100 milligrams, that'll be just half an ml. Taurine could be 50 milligrams. And vitamin B12, I would give them 2000 micrograms. There's a special preparation of vitamin B12, 10,000 micrograms per ml, so the total volume can be kept low. Vitamin B complex, again, I would take about half a cc. B complex, about 25 to 50 milligrams. There's a golden rule in our work. Start low, build slow. There's no reason to be heroic in all this. I do recommend initially for a period of 4 to 6 weeks, twice weekly injections of this protocol. But I always integrate it with therapies addressing the problems, detect, diagnosis and treatment of mold allergy, food allergy, gut fermentation, leaky gut state. And if there is inflammation, for example, eczema or oral thrush, that really requires robust antifungal therapies. And I use personally nystatin intermittently for 6 to 12 weeks in difficult cases. The strength of the oxygen model is that it tells you to be sensitive and be aware of all the oxygen related problems, because the end result depends upon how many insults can you detect and address to allow the strained and the insulted brain cells of the unborn child or infant or a toddler to recover from these insults. Please look at other segments of this series on oxygen model of autism. I give you the evidence for it. I review some literature. But above all, I tell you what my pediatric patients, who are my true teachers, and their parents have taught me about these problems. Please look at www.kids123.org, kids123.org. Look at the large articles that I posted. This is a biologist view of autism. It's not a psychologist view. I don't think autism and developmental challenges are psychiatric disorders at all. I don't think talk therapy has any role to play in it. I have seen sometimes excellent results by these dedicated professionals who focus on the developmental issues, and that could be a preschool type of a setting, or this could be a day type of a program. But sometimes I have seen that be very helpful. Above all, as heart-rending and deeply disappointing and disturbing these conditions are to be a parent of an autistic child, what my patients have taught me, that years later, the situation improves dramatically in most cases, provided you continue to do the right things. Children's Health Code was funded and founded by Talat, my wife, and I for the mission of providing authentic information for children worldwide about nutrition, environment, and stress. Of course, we try to reach children through their parents and grandparents and teachers and some enlightened citizens. Support us, forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts, and mention this website to your friends. Visit our website and we will tell you how you can participate in our vision. We invite you to join hands with us. Let's do something good for our children. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.